recording of the video now, and we will be having our introduction from the Chair of the ASEAN Council, which is a pre-recorded message. Christine, if we could have that message, that would be wonderful. Thank you.
Hello, my name is Glenn Keys, and I am Chair of the Australia ASEAN Council and the founder and executive chairman of Aspen Medical. My apologies that I'm unable to attend in person today. I would like to acknowledge the traditional owners of the land on which we all meet. For me, this is the Ngunnawal people, and I pay my respects to elders, past, present, and emerging. I would also like to acknowledge any Aboriginal and Torres Strait Islander people joining us today. The project which you are launching today is a very important one. Over the last 2.5 years, we have witnessed the importance of health recovery and its direct impact on lives and livelihoods. It has shown us the importance of anticipating and responding to emerging health challenges is more pressing than ever. This project will make a meaningful contribution to this ambition through building a vital network across the ASEAN region, our neighbourhood, to consider regional responses to antimicrobial resistance. As Chair of the Australian ASEAN Council and someone who is passionate about providing medical support to those in need, I am pleased that we are supporting this project. The University of Sydney was chosen as one of only 16 grantees in our 2021-2022 grant round, as this project represents a great opportunity for cross-country research collaboration. Since 2015, the Council has worked closely with partners in Australia and Southeast Asia to build cultural awareness and mutual understanding. Through our grants and flagship programs focusing on innovation, youth and religion, we can see the tangible benefits of active partnership, communication and cooperation, even during a global pandemic. The importance of listening to the individual voices across Southeast Asia has never been more important to Australia, and it helps it shape its understanding and engagement across ASEAN. Partnership with our Southeast Asian neighbours are critically important to Australia. We have a shared stake in our region's ongoing peace, health security and economic recovery. Since taking office a few months ago, Prime Minister Albanese and Foreign Minister Wong have made it clear through their visits to the region that Australia is serious about engaging in global and regional challenges. Our long-standing relations with the countries of Southeast Asia are crucial in this regard. This year, Australia celebrates 70 years of bilateral relations with Cambodia and Laos, and next year marks 50 years with Vietnam. Our cooperation remains ever important in response to health challenges, including COVID-19. The Australian government provided more than 25.5 million vaccine doses to these three countries, along with vaccine rollout, support and technical expertise. Through my work with Aspen Medical, I have witnessed firsthand the closeness of Australia's important relationships with the region. This includes establishing major health infrastructure in Indonesia, with a program designing, building and operating 23 hospitals and 650 primary care clinics across West Java, one of the largest health infrastructure programs in Indonesia's history. But it takes more than just health infrastructure for communities to benefit. It is the hard work and dedication of professionals such as yourselves who truly transform the potential and opportunity that comes with sharing knowledge, building capability and expertise. Projects that reach beyond our shores and give evidence to regional cooperation, such as the one that you are part of today, is where another dimension is added. So thank you for your attention and, more importantly, your ongoing work and efforts to help improve this country, the region and the world we live in. I hope you find the learnings, opportunities and networks from this project valuable. I have no doubt they will be.
So that is a great message to kick off the meeting, focusing on, as it does, on the importance of cooperation for those regional challenges. AMR, I think we would all agree, is one of those sort of wicked challenges. There are many drivers of antimicrobial resistance. They vary by country, but it's definitely a shared challenge. All of our countries, Australia, Vietnam, Laos and Cambodia, have as part of their action plans to address antimicrobial resistance to conduct research within a One Health framework. And as you have all agreed to join this meeting, I can see that you're people who agree that this is important and a very vital way of addressing the AMR pandemic. But One Health research in AMR is not easy, and regional research is even less easy. And there are a couple of key problems, I think, when I consider the issues that are the barriers to doing One Health AMR research. One of those is the disciplinary nature. So we're good at doing medicine, we're good at doing agriculture, we're good at doing veterinary research and policy. But the research and policy that falls between those pillars is often difficult, and that's exactly where One Health falls. As another major issue that I've observed is an infrastructural problem. So there may be lots of good microbiology labs in hospitals, for example, but they're not always willing or able to handle samples from environmental or animal sources. So that creates an infrastructural issue. And the third big issue on this regional level is the difficulty of sharing data, sharing samples, and establishing good networks that work together to address the same problem. In the meeting today, we're going to do as much as we can to address those last two in particular, looking at the infrastructural issues and needs, and the needs and barriers to forming good networks to tackle these issues in our region. The format of the meeting is that we will start off with some further introductions. We will have some presentations, brief presentations from Vietnam, Laos, and Cambodia discussing One Health AMR research in those respective countries. The idea of those talks is to be a stimulus for the discussion that will come later. So once those talks are concluded, we'll have a brief break. Everybody can get a rest and charge up on cups of tea, and then we will enter into some breakout rooms per country, where we will have discussions about the opportunities and the challenges within countries. We'll talk a little bit about what would be needed to maximize research potential within countries. And we'll also ask you to discuss what you perceive as regional challenges. So once we've set up those rooms, we'll ask you to join them yourself, whether that be the Vietnam room, Cambodia room, or Laos room, whichever is most relevant. And we will be using whiteboards for the discussion. So myself, Harish, and Leanne will be in those rooms, but we're really there to take notes and capture the discussion. We will be asking you to rank some of your challenges and opportunities, and we'll gather together that information to report back and have a debrief session on what we've identified so far. We'll then discuss the next steps of this project. As we all know, this is the first in a series of steps. So hopefully that's clear enough. We will update later on about how those breakout rooms are going to work and give you a little bit more information as you go into them. But for now, it remains for me to introduce Peter Horn, who is joining us from DFAT to further welcome and introduce the meeting. So Peter, I will hand over to you. Thanks.
Thank you so much, Justin. Good morning, good afternoon, everyone else. Also, as Glenn mentioned, I'm similarly speaking from Ngunnawal country here in Canberra. Would also offer my respects to leaders past, present, and emerging. Also, thank you to Justin and Leanne and others and everyone involved in organising this event. I think it's a really exciting thing that we're that we're kicking off here. And I know some of my colleagues here at the Centre for Health Security at DFAT are also online. Looking forward to the discussions and really engaging in this process of information sharing. I think just to offer a few thoughts at the outset, I think Glenn really touched on the importance of ASEAN to Australia. Our foreign minister recently described it as being an indispensable entity. And one of the reasons that I think that's the view is that there is so much of a linkage between Australia and ASEAN countries. And that's being forged through dialogues such as this, whether they be on climate change or cybersecurity or on energy or education, and also, of course, on health security. I think these are discussions and events where we can get to know people, get to know what the experts are doing in our area, and really forge those bonds and forge those links. I think for just to say a few comments about where we are. So as many of you will already know, the former foreign minister announced a further phase of funding for our $300 million health security initiative. There'll be a further 375 million that was announced that will be rolled out over a further 5-year period, and we're going through the design process for that at the moment internally. A lot of the focus will be around how we build from the lessons that we learned since 2017. Obviously, a lot has happened in the health security world since 2017, and one of the key things that we've seen coming out, particularly within the CHS and the way that we have been engaging with our partners, is that AMR, as the wicked problem that Justin described, and One Health more generally, are really being identified as areas where there is room and a need for greater focus and increased work. And that's something that I and my colleagues here are really working towards and looking forward to prosecuting over the months and years to come. So with that, I'll just I'll close, but say thank you very much for having me. Thank you very much for having us and for all the work that you're doing. Best of luck with these discussions, and we're following with interest. So good luck. Lovely to meet you all. Thank you, Justin.
Thank you, Peter, for those kind words. I will now hand over to Harish, who is our project coordinator. Give him the opportunity to introduce himself properly. I know many of you have been receiving emails from him. He is going to introduce our series of 4 speakers who will be sharing their perspectives on One Health and AMR over the next roughly 1 hour before we take a break. So Harish.
Yeah, thank you, Justin, and welcome to you all. As Justin said, I'm the project coordinator on this project, and it was lovely interacting with you all. I'm sorry, I was very keen on all of you joining, so that's why you had emails coming from me even this morning. But thank you so much for responding, and we've got a very handsome strength of 40 people here. So true to the spirit of One Health to be used in AMR, we've got speakers from the 3 countries, followed by Wohun's perspective to be given by Dr. Pham from Vietnam. So first, I would like to welcome Dr. Sathaira Thum and Dr. Krang Sidon from Cambodia. So Dr. Sathaira is a veterinarian, and he is the director of National Animal Health and Production Institute in Cambodia. Dr. Krang, who will be also co-presenting this, is the Deputy Director of Communicable Disease Control Department, Ministry of Health, Cambodia. So as I said, true to the spirit of One Health, here is a perspective of veterinary and human health towards AMR networking in the region, and this is the Cambodian perspective. Welcome, Dr. Sathaira and Dr. Krang, over to you.
Thank you, Dr. Harris. We will have 2 presentations separately, one from my side and the other one from Dr. Sidon. So I will go briefly. Can you allow me to share my presentation, please?
Yes, please do.
Okay, I will guide you. First of all, thanks to Justine, Harris, and colleagues for putting this up, and thanks to the Australian government for provide this opportunity to the three countries to further enhance our capacity on AMR. So my presentation this morning is about the antimicrobial resistance in agriculture sector in Cambodia. So there's some key note that speaks that I will deliver to you. So this yes, provide brief background. As you may already know, that around 700,000 human deaths each year are due to this AMR issue. And 27 different antibiotic class has been used in livestock production. The total global animal health market in 2011 provided by the WOW was estimated around 22 billion. And only 89 countries has report having a system in place to collect data on the use of antimicrobial agent in animal. No standardized data available on the global use of antimicrobial in livestock yet at the moment. And by 2050, there's a prediction that over 10 million people will die across the world from this. There's some problem has been stated by the World Health Organization on the antimicrobial use. The issue is prescribed and patients not finish their course of treatment, our use of antimicrobial in livestock and fish farming, poor infection control in hospital and clinics, lack of hygiene and poor sanitation, lack of new antibiotics being developed. So this is the important things. Sir Alexander Fleming state that it's not difficult to make microbe resistant to penicillin in the laboratory, and the same has occasionally happened in the body. So I would like to share some possible cause of AMR in the countries. Here I share, I separate into category of stakeholder who use antibiotics. The smallholder that in Cambodia, antibiotics can be purchased from any drugstore. There's a discriminate use of antibiotics by village health animal health workers and farmers regarding the dose, the cost of treatment, and most important things, that no proper prescription for the use. In the commercial production side, the use of antibiotics as a growth promoter and disease prevention has been seen. This practice is commonly used in poultry and pig production, and sometimes we see in aquaculture. The dose may vary between a producer because they got the advice from the drugstore, not the with. Use antibiotics in crop has not been seen widely at the moment, but the use in aquaculture is obvious. We have, fortunate today, we have a colleague from aquaculture joining us as well. To respond to this, the Ministry of Agriculture has established the AMR technical working group in the ministry, involved 15%, including the chief of the technical working group, vice chief member, and secretary. And we have 2 or 3 representatives from each institution under the Ministry of Agriculture. In this working group, we also have some developed partner joining us, including FAO. We have a clear role and responsibility for this, particularly the develop research and initiative their own department to implement National Action Plan on AMR in agriculture sector and provide recommendation on the identification of the AMR risk, follow the rule of World Animal Health Organization, World Organization for Animal Health, the OIA. So this the 4 main institutions that participate in this technical working group. We have General Directorate of Animal Health Production that we am from, the Fishery Administration, General Directorate of Agriculture, and Royal University of Agriculture. So what we are doing from the we use the global perspective to develop our national action plan, and this the current activities that MAF have conducted to solve the problem. The governance is the talking about the good agricultural practice, good animal husbandry practice, and good aquaculture practice. So this guideline has been adopted from the ASEAN guideline. We have degree, sub-degree, and other relevant legislative document to manage the use of antimicrobial. In terms of practice, to support this, there's a vaccination campaigns, slaughterhouse inspection. We insert this program into the Cambodia applied veterinary epidemiology training to provide the information to the current. Promote the organic farming system in the country, creation and management of village animal health worker, and they also train and provide a refreshing training to them, particularly the use of antimicrobial. The awareness, we participate on in the World Antibiotic Awareness Week, and we from our side, we developed a newsletter jointly developed by GDHP and FAO, integrate the AMR to veterinary curriculum in the Royal University of Agriculture, and integrate AMR to provincial with level or coverage training, as earlier mentioned. The awareness among private sector, and we conduct the meeting and workshop on this. There's some research ongoing here in Cambodia. You will see what we are doing, particularly the current surveillance activities. CAP also has been used to identify the current practice of people in the field, particularly in chicken, in poultry and pig production. This just provides some list of law and regulation that support the AMR activities in the countries. And these are our current surveillance activities that we are doing. This including the surveillance in collect the meat from a slaughterhouse, from wet markets, and also from farm. Particular the recent one, we're looking for the Aromonas hydrophilia in a slugfish cat in Cambodia aquaculture farm. So and this just our product from the research study convert into the scientific publication, and then we also have students coming work with us with the poster to present during the meeting, workshop, and national conference, something like that. That's all from my end. I will hand over to my colleagues, Dr. Kang Sidon, to present to you on the antimicrobial in human health sector. Thank you.
Yes. Good morning, ladies and gentlemen. I'm Dr. Sidon, so we continue from Dr. Tumstira. So may allow me to share the screen, please.
Yeah, go ahead.
Did you see my screen?
Yes, you can see.
Okay. Yeah, good morning, ladies and gentlemen. I'm Dr. Sidon, the Deputy Director of Community Policy Control Department, Ministry of Health, Cambodia. I'm a secretary of the AMR Technical Working Group as well. So today I would like to share a bit about the AMR surveillance in Cambodia and lesson learned and challenges in this field. Yeah. So as Dr. Tumstira presented the animal health in Cambodia, and I am presented the human health in Cambodia. In my introduction, so in this in Cambodia, Ministry of Health established the AMR Technical Working Group in 2012, yeah. And now we updated and revised the membership by including representative from the agriculture side and the Ministry of the Environment side. And I would like to let you know as well that Cambodia has a strategy and policy to combat AMR since 2015 until 2017. And we continue to have the National AMR Surveillance System, SOP, that implement in early 2018 until now. Yeah, and other activity of AMR coordination structure that we had in the Ministry of Health as well, like the infection prevention control and the National Antimicrobial Stewardship program. And AMR as well, we had a coordination structure at the sub-national level. And I would like to let you know as well, in the AMR working group in Ministry of Health in Cambodia, we had composed of the stakeholder, like the department among Ministry of Health and the national program like TB, like the HIV as well. And so far we had the funding and technical support from US CDC, OICA, WHO, the MVP, and Onco Hospital for Children as well. So since the SOP that monitor about the AMR surveillance, we endorsed in 2017, and we implement in ASEAN side in early 2018 to monitor for the AMR trend in Cambodia. So we have 8 sentinel side now. So our achievement in Ministry of Health that after the apply of the SOP, so we got the data that we can submit to the global GLAS, I mean the global antimicrobial system. Since 2018 until 2020, that we need to share, we can share to the GLAS system, yeah. And we also organize the mid-year and annual review workshop, even though like last year that we got outbreak from COVID-19, but we still held the workshop and to review of this activity. And also we conducted the training, AMR surveillance SOP, like data management and competency assessment regarding to the lab capacity. And we conducted the quarterly supervision to the side that we got the 8 sentinel site. And another thing that we can support for the AMR, like the reagent to the microbiologists, and we send the isolate from the sentinel site to the national referral lab. They located in Phnom Penh City, and we do the confirmation in that. In this activity as well, our laboratory, we conducted the enhanced internal quality control and external quality assurance as well for the microbiologists. This activity for the AMR surveillance in sentinel site that we went to the province that talking about the AMR and would like to know about the AMR surveillance in those site. Yeah. So this is the activity in each province that who apply, who use the SOP for AMR surveillance. Yeah, this one. And this one, I would like to share the data for the 2 types of sample that we collect, that means blood and CSF. That in here, we regarding to the global action plan, we select only priority pathogen, 7 priority pathogen that we need to report, and we need to monitor all the AMR surveillance in the country. So this is the positive rate. As you know, you can see the positive rate in like the yellow, and the sample number of sample in the green color. Yeah. Like we collect here, you know, the 8 sentinel site from 2018 to 2021, as you can see in the bar chart here. So 2018, like among 22,000 sample, that the positive rate only 2,000. So like around 10% of the positive rate. As you see in the 2021, that the outbreak occurred many in for COVID-19. So the sample size is a little bit low, and the positive rate also a bit low, like only 9% of the positive rate. Yeah, this is the for the CSF. This is for blood, and for the CSF, we sample is too small for among these years. So, like for example, 2018 we had only 700, and positive is only 19. It's small. And for the 2021, that we had only 900 sample, and positive only 18. So that means the 8 sentinel site that collected the CSF from the patient is not so high, and the positive rate is not like approximately average like 2% only. Yeah. And even though we conducted the AMR surveillance regarding to the AMR surveillance, so we had a challenge from this implementation this year, that we don't have the like the activity much for the AMR surveillance, and we got some small budget from the multi-draft fund that the AMR data is not the limited use of the AMR data to enhance the antimicrobial stewardship and IPC. And the funding now is like the stop by, and we don't have the supply anymore to the sentinel site. And the AMR like AMR reporting system in some sentinel site. Also that we use not the same system, like 5 only the same system, another 3 not the same system, but we can cooperate in the AMR surveillance system in the district of health. Now no new site have been added to the national surveillance system, that we would like to do that in the coming year, but we don't have fund to support it. And for the no evaluation of the national AMR surveillance that have been done so far, and I think that every country in the face with the impact of the COVID-19 pandemic, so the Cambodia as well, that can have the challenges of the implementation of the AMR surveillance as well. So next step, we looking forward to get some funding support from the partner, and the priority activity that we need to conduct it as I mentioned in the next slide. So those activity that I would like to set for funding support, that I ranking with the 3 color of this activity. So the first that we need to do March, that means that we need to evaluate the national AMR surveillance in Cambodia. And the second one, we conducted the competency assessment training to the microbiology staff, that we need to upgrade them, or we need to build their capacity to do this job. And the third one, that we need to provide the internal quality assurance for make sure that the national referral lab can do the proper the quality. Yeah, and we need to do the bulletin. Yeah, now we established the bulletin for AMR that we plan to deliver every quarter. Yeah, and we need to conduct the annual surveillance review workshop as well. And at the end, we need to support to the sentinel site for area agent and other consumable. And yeah, and the yellow one, that all these activity that we need to do related to the AMR side, AMR surveillance, also that we need to conduct the quarterly supervision to microbiologists in the site, and the IPC, Infection Prevention Control, antimicrobial stewardship as well. And another one that we need to like data management and report, yeah, because we need to review and train them how to make the data in much quality than, yeah. And other activity that I list down here for your consideration. So I don't want to read this one for this. And the green one, that we really need to get support from the other source of for the AMR surveillance, as well as the all activity that related to AMR, that we now focusing on the One Health approach. Thank you very much for your listening. Yeah, thank you.
Yeah, thank you so much, Dr. Suthaira and Dr. Krang. You really set the mood for the meeting by talking about the governance and the practices, the research, and the surveillance. Also, you have ranked your priorities, so that's a very good thing, and it has really set the mood for the meeting. Now, I would like to invite Dr. Vilada Chansumoth from Laos. Dr. Vilada is a leading researcher. She's an epidemiologist, and she has been a Wellcome Trust Fellow. She's a researcher of repute on AMR. She has published on the AMR situational analysis in Laos. She will be speaking on the review data on AMU and AMR in both human and animal sector, in Laos. So welcome, Dr. Vilada. There's a request that if you could restrict your presentation for 15 minutes and keep an eye on the chat box. I'll give you when your 1 minute is left. So welcome, Dr. Vilada. The floor is yours.
Thank you so much. Thank you. So I would like to share my screen now. So have you seen my screen, my PowerPoint?
Yes, if you could put it to full screen. Yes, wonderful. Thank you.
Okay. That's, thank you. Thank you so much. Good morning and good afternoon, everybody. So thank you so much to have me here today. Today, I would like to share with you the most recent review of antimicrobial use and resistance in humans, animal, and the environment in Laos. Sorry, cannot move. As most of you here have known that antimicrobial resistance, or AMR, is a global public health concern, and one key driver of AMR is irrational use of antimicrobials, either misuse or overuse. Its burden would be huge if there is no appropriate action. Laos is like many countries where different sectors tend to work on their own on different strategies to combat with AMR. So understanding AMR situation in the country is the key important to control and prevent AMR. However, the use and the resistance of antimicrobial data in Laos was scattered and scanty. Therefore, Laos Technical AMR Working Group under supervision of Ministry of Health review data on antimicrobial use and resistance in human, animal health, and the environment in Laos to identify the gaps and inform AMR policy. This is a narrative review which included both peer-reviewed and grey literature relating to human, animal health, and the environment during 1994 to 2020 in Laos, French, and English languages. The reason we started from 1994 was because it was the first year that there was a publication relating to antimicrobial susceptibility in Laos. This review only recruited data related to antibiotics. So our search terms were related to Laos, of course. The use and resistance of antibiotics and antimicrobials, WHO class pathogens. For grey literature, we included report thesis, student thesis, datasets from various places such as universities, research institutions, related ministries, and departments. As majority of data we found were from epidemiological studies, surveys, and datasets. Therefore, the quality of the evidence was not graded in this review, and we display data descriptively. So after screening more than 1,300 titles and abstracts, 170 full peer review and 12 grey literatures were obtained. And after review full literatures, only 80 of them were included in this review. The majority of them were related to human health. Only 11% covered animal health. Only 5% covered both human and animal health. And only 1% was related to AMR pathogens in the environment. Data on the use of antimicrobials were found just over 20% of all data we had. And 15% of data sources were from datasets and great literatures. This review focused on many WHO class pathogens, but because of time limit, I will only present 2 pathogens which are outstanding and with long-term monitoring. So ESBL producing E. coli was firstly described in patients' blood in Laos in 2004. Since then to 2016, ESBL E. coli increased from 7% to 35%, whilst more recent data showed 53% of ESBL E. coli from Julin from a central referral hospital in Laos from 2017 to 2018. First case of E. coli carbapenem resistance was identified in 2015, and by 2020, there were 10 cases in total from the whole country. So for MRSA, MRSA has been monitored in Laos since 1994. The first MRSAs from clinical specimen was identified in 2002, and the first MRSA bacteremia was reported in Laos in 2017. By 2020, 15 MRSA bacteremia were identified in total for the whole country, whilst non-blood culture specimen data show 15% of MRSA infection during 2017 and 2018. In case you want to explore more about AMR data in Laos, here is our AMR, sorry, I have to go back. Our AMR dashboard, where you can find more recent data on received specimen types, and data on antimicrobial resistance by age, specimens, or location. The website is here, is for public, so everybody can access. How about in animal? Only 3 published articles were related to AMR in animal health alone, and another 3 articles described AMR in both human and animals. The majority of studied pathogens were Salmonella species and E. coli. The contaminations of Salmonella species in different animal products range from 39 to 93% during the survey period from 2007 to 2017. There was evidence of ESBL, E. coli from food production animal, and evidence of colistin-resistant E. coli from pigs in Laos. Here are some more recent available data related to AMR in animal health in Laos, which have been published recently. So you can find more information, very recent information from Dr. Put Intawong and his team about pig and chicken E. coli and Salmonella contamination in pig and chickens from this article, which is so interesting. And then lots of colistin resistant data that you can find from recent year. So as mentioned at the beginning, that only 22% of all data we found were related to antimicrobial use in Laos. Of these, 78% were related to the use in humans and only 22% in animal. Data from 2004 to 2018 showed that AMU among inpatients ranged from 45 to 70%. 94% of patients with upper respiratory infections from outpatient department received antibiotics. This is a study from Sawanakhet, which is in the center of Laos, in many health facilities. The use of antibiotics in community was nearly 40%, and self-medications was common. Here is our, this one is our data on hospital antimicrobial prescribing in Laos from 2017 to 2020, which have been just published recently. So if you want to explore more about data from Laos, how we prescribe, how patients receive antibiotics when they are admitted to hospital, this one would be the choice. Yeah, and you can also explore more recent hospital AMU data in both in and out patients, while this AMU dashboard so is also is for public, is free, so everybody can access. So for animals, only 6 data sources related to the use of antibiotic in animal health from our search. Most of them focused on targeted treatment rather than growth promotion. More recent data showed from this one. More recent data show that nearly 50% of chicken farms and 60% of pig farms admitted that they gave antibiotics to their animals. Only one article described about AMR pathogens contaminating in the environment, and it was published in 2004, it was a long time ago. So as you can see from my talk, that available data on AMR and AMU in Laos are scattered with limit of systematic surveillance. With however, this made us have to be more careful about how to interpret the AMR situation in Laos. However, from this review, AMR data on some grass pathogens in Laos are relatively low, except E. coli, which increases every year. Therefore, it's vital to enhance the surveillance, collaborations between human sectors, animal sector, and the environment, and making sure that everybody has access to antibiotic when needed and the appropriate one. Stewardship program must be strengthening. More update data on the use and resistance of antimicrobials in animal health and the environment are needed. Control the use of coristin in animal and the rise of ESBL producing enterobacteria in both human and animal, and prevent the rise of Staphylococcus aureus and the rise of the resistance of some key antibiotics of the Staphylococcus aureus and Salmonella typhi before it's getting worse. Thank you so much for your attention.
Thank you, Dr. Vilada. That was a very great presentation. Thank you for all your work there, and for everybody's knowledge, the article is present, is easily accessible, and you can go through it. Next, I would like to invite Dr. Phuc from Vietnam, who will be presenting Vo Hun's perspective of the AMR in his country. Dr. Pham Dum Phuc is coordinator of the Vietnam One Health University Network, Vo Hun. He is the Deputy Director of Center for Public Health and Ecosystem Research, Hanoi University of Public Health, and Director of IEHSD, which is an Institute of Environmental Health and Sustainable Development. We are lucky to have Dr. Phuc with us to present on the Vo Hun's perspective. So over to you, Dr. Phuc.
Thank you very much. Can you hear me?
Yes, we can. Thank you.
Thank you, Harris. Thank you, the team, and with my son today to sharing our network and how we are thinking about the antibiotic resistant research and training and education. First of all, I would like to introduce a little bit our network. So as you see in the map here in Vietnam, along the country, from the north to the south, it's our network starting in 2011 with now it's a totally 27 university, including medicine, it's a public health, nursing, it's agriculture and forestry university. So it's our key, it's a goal, it's to develop the One Health concept in our network. So before I talking a little bit about the in Vietnam, you can see here in Southeast Asia, you're gonna see who in Southeast Asia One Health University Network. At the moment, we have 8 countries, including our colleague today in Laos and Cambodia. So we have Indonesia, Malaysia, Myanmar, Philippines, and of course Vietnam. So in the future, we try to expand it to Singapore and Timor-Leste. So that now in total 95 university from different background, it's a discipline we are working together. So we invite 6 university from Taiwan. They also starting join with our network at 3 years ago until now. It's not co-funding together. So what our goal here is develop a resilient and competencies of One Health workforce by leverage of education, training, research to provide it for our university member to improving capacity in Southeast Asia. Besides that, it's USAID, they also support other network in Africa, including 10 countries at the moment. So actually today, this week, we have a conference on One Health in Bangkok. I joined it and setting a network between Southeast Asia and Africa. So it's a good chance to us to make research collaboration, South-South collaboration in the future. Our network is advocated for the role of university to provide the capacity building. It's a very, very important. Like a professional across the sector, human health, animal health, and environment, also need a complex on health issue. So antibiotic resistance is one health complex issue. So the second thing that we are doing some research that matter. It's a case study to have the student and our faculty have chance to learn. It's a One Health in the real context. So that is easy for people to understand the One Health and provide a concrete evidence for the policy maker and inform to the community member like the farmer. They can change behavior practice like use antibiotic in the livestock production and how to reduce the burden of antibiotic resistance. And of course, we can support for public health. It's a certain capacity like during the outbreak, investigation or COVID-19 pandemic, our network contribute for it investigation like communication and collecting sample and separated cases at the community level. You see here, so that it's our Vô. I'm focused a little bit more in Vietnam. So it's a Vô in the center at the heart. So Vô it is easy connecting with the different international partner, donor, national partner, including the private sector, NGO, and we are conducting several activities. It's a first thing is more focusing on training, it's building capacity for our local partner from the provincial level, district and commune level, both human health, animal health, and environment. And of course, all the trainings that we need to provide it a very good example based on case study. So research activity, like it's a zoonotic disease or antibiotic resistance, it's a very good example. And also the food safety, it's a good case study for teaching One Health for different people from different background. So that you see that in the map, you got a different funding sources, also different partner, and it really it's very important. It's a local partner. As I lead here, it's working directly. It's a center for disease control at the provincial level, and it's a hospital. Also, I've got a sub-department of animal health at the provincial level. And we are, of course, working with a research institute, both in the human health and animal health. So it's a research team, and they conduct the activity together. So here, it's a One Health side. We already actively in some commune. We selected some province where we have university located. Also, the university connecting with the CDC and the sub-department of animal health at their province, and both the university and the government agency in the same province, they exchange to interaction exchange together on One Health. For example, antibiotic resistant. We're not talking separately. We need to invite all of them at the same time into discuss and to identify the issue together and identify the solution and take the implementing together. So that's the model we already set up. SIG, it's a One Health site in Vietnam at the moment, and in the future we try to expand the network in other province from the north to the south. And lastly, it's very important how we can translate the knowledge and research finding into the policy maker and to the commune. So that's why our network Vohun connecting very well with the National One Health Partnership. It's located at the Ministry of Agriculture and Rural Development, and it's joined with the Ministry of Health and Ministry of Environment. And Vohun also one member of Pandemic Driven Task Force, PPTF. It's more focusing on wildlife, it's farm conservation and consumption. So we are provide its knowledge and help them to communication. And of course, for other working group like food safety or climate change or even in the plastic and health network. So this network is very help us to easy to connecting at a higher level, and they are really to change their mindset about the One Health concept. So that's the one good example. You know that the antibiotic resistance. I'm not in expertise about this antibiotic resistance, but it sees it's a picture. It's really the One Health issue. So that if we can addressing it, only human health sector cannot. Only the agriculture sector cannot do it. Only environment cannot. Or it needs with economic or the social perspective also with a government authority. So with government authority, they very strong voice to connecting different sectors. So it means that it really is One Health working. It's connecting all the sectors work together. So that's antibiotic resistance is One Health. And just now we try to promote using One Health concept to conduct research on antibiotic resistance, and not only in one location, not only one country. So that is connecting, it's international. Now it's out in Indochina, in Vietnam, Laos, Cambodia. So how we are connecting and working together in addressing its antibiotic resistance. So beyond that, you need to see a lot of challenging and opportunity for us to conduct AMR research. So we are made some summary, some key it's a challenge here. Like it's an antibiotic microbial resistance, it's a multi-dimensional nature. So we see that in the picture in the previous slide. So the second thing, the challenge for us limited or lack of fund for research AMR, and different research priority for the AMR. So in different countries, even in Vietnam, different research institute, different universities, they have different prioritize research on antibiotic resistance. And we are at lack of the regional center for antibiotic resistant leadership, and we lack of trust among the researchers. So because due to the previous their experience and equitable collaboration, because the quality of research and the research design not really clear, and they're not sharing. But earlier, that's why they not chat together. and unequally it's a powerful relationship between the researcher, human health, animal health, environment, or even people working in the hospital and like public health like us. Sometimes we not really like equally in the relationship, and it's a negative, of course, for during COVID-19 pandemic and for other in the research collaboration. But basically, a lot of opportunity here now at the moment. It almost the researcher is willing to collaborate together, and formation some field network like us today. I think it's very important and on time to sharing information, data, and experience among the antibiotic resistant research, and we try to bring encourage academic people, scientific to use One Health approach to conduct antibiotic resistant research. And of course, make something new. It's a strong collaboration between different disciplines through cross the country. So now we are network in Southeast Asia on One Health, Laos, Cambodia, and Vietnam, also Philippines, Thailand, Malaysia, Indonesia. So we are good chance to link it to other countries. So of course now we have Laos, Cambodia, with Vietnam, we try to thinking how we are proposed to work together. It's a real context. And of course we need to take one leadership in the center in the regional level for the antibiotic resistant research and training. And of course, we need to sharing the priority, transparency, and transferable. It's fun together. And lastly, it's improving the capacity on the research in the regional level, like how it allows colleagues in support for Vietnam, or Vietnam colleagues in support for Cambodia, or Cambodia in support for Laos. I think that is very important. And of course, from the Australia partner, we are a lot of experience and have a technique to support our colleagues in Southeast Asia. And the last thing is, I give one example at the moment. It's an ongoing project. We're starting in 2012, this year until 2025. So this project is under the joint programming initiative on antibiotic resistant, AMR. So this network includes 29 countries, and at the moment 137 projects and more than 100 million euro invested already. So we are very luckily at our research center and the Vohun collaborate with hospital, a pediatric hospital in Hanoi, and with our colleagues from Germany, from Sweden, and from Denmark, and of course from Syria, France. So of 4-5 countries we are developed this project, and we are really using One Health concept to propose intervention to decrease the carbapenem resistance and the Ria said at the CIE colony. So you see here, it really is a One Health. We are follow patients they discharged from hospital. So before any the patient is admitted in the hospital, we are testing CIE. So CIE positive, we need to propose the intervention at the hospital, like separate room. And after the patient discharged, go back home. So we are follow them where they are living, and collecting sample from the family member, and we follow up after 1 month, after 3 months, and after 6 months, and after 1 year to see how it's a transmission, it's a CIE between the people living in the same family, and to see how they are linked with each animal raising in their house. So that we take a lot of opportunity to working with a local partner. It's a different sector of human health, animal health, and so environment, from hospital, community, and livestock production. So it's really, I like that very, very much. It's a research, and we also got support from different countries, from Germany, Denmark, France, also in Sweden, and of course from our in the clinical side and the microbiological laboratory, also public health people, and it's a vet people work together. So that on I think that antibiotic resistance as one health issue, and it working together, and that based on that we need to really to based on 7 One Health core competency. How we have good knowledge and skill on leadership, how to collaboration, keep the partnership to the system thinking more broader, more deeper, and how to manage and make learning together. And we need to really to under the culture and belief from different contexts. And we need to make frequent communicate each other and how to manage the data and sharing data together. So that's all for my talk today. Yes, thank you very much. And I'm happy to answer the question. Thank you very much.
Thank you, Dr. Bhuk. That was wonderful. In fact, the kind of networking that Sihun has been able to orchestrate, I think that forms the blueprint of something we endeavor to do with this project in AMR. And also it was great for you to point out the challenges and opportunities of the AMR research in the area. So thank you very much for your wonderful presentation. The last but not the least speaker before we go on a break is Dr. No Thi Hua. I just hope I've pronounced it right. And she will be speaking on the perspective of AMR research that's going on in Vietnam. Dr. Hua is a molecular biologist, microbiologist, and she heads the zoonosis group at the Oxford University Clinical Research Unit, OCRU, in Ho Chi Minh City, Vietnam, which is a Wellcome Trust program. She's a visiting lecturer at the University of Science and Open University, Ho Chi Minh City. She has been working on the genetic and antimicrobial resistance of zoonotic pathogens and burden of zoonotic diseases for potential intervention for prevention and reduction of zoonotic transmission and infections. So welcome, Dr. Hua. The floor is yours. Just to remind you that the talk is 15 minutes. Keep an eye on the chats and I'll give you a message when it is 14 minutes. Over to you. Thank you.
Thank you very much, Harris. I'm sorry that I joined late. I missed up the time again. I thought
you're perfectly in time.
Yes. Okay. Today I would like to present some of our study on AMR within OCRU. I actually recognize that Roki joining, so some of the study I will present in the OCRU group and will be with Roki as well. So if you have more questions, Roki may be able to answer better than me as well. So this is the list of people working in AMR, antimicrobial resistant at OCRU University, and you can recognize, I think Thomas is also in this meeting, if I don't mistake it. Antimicrobial resistant working group in OCRU started several years ago, and we also involved with policy maker led by Hanoi unit. And here we're presenting our partnership in several study with AMR and also in part of the One Health network in Vietnam. I need to show slideshow, I think, yeah. And this work list mostly, if you can find here in Vietnam, it's also that OCRU in Vietnam also collaborate with NHCD, National Hospital of Tropical Disease in Hanoi, to set up the National Reference Laboratory for Antimicrobial Resistance, which is founded by Madame Tien, as you see in photo. We're also part of the several network of AMR in Vietnam as well. More detail, please, in a discussion with Rokia later, because this work led mostly by Rokia and previous. So at OCRU, we, something with my screen, close it, okay. As OCRU, we have the we build a schematic of what we are going to do with antimicrobial resistance. We are, as our study actually involved human side, as you see, medical, also the animal size of it. And we are also interested in antimicrobial resistance from environment, from food, from water, soil, etc. But looking at it as a whole system and how it affects the public health and patient. So the major research question objective of our group include, as we show in the slide, is how we improve the outcome of patients with drug-resistant infection, which is one of our major concerns for at least 30 years that we're working in Vietnam. How can we improve the surveillance by collecting more actionable and locally relevant data? How can we reduce antibiotic in low-level healthcare and community, provincial, district level, hospital and farm, at looking at the One Health, because we know that the level of use in the local area is maybe very much depend on individual as well. And we can talk about that more later. And we would like to, we are in the process to develop in-house high throughput whole genome sequencing and bioinformatic capacity while linking up with the relevant networks. I'm saying that we have a group, MON-AP, and the other member of other group in our unit to working on whole genome sequence, but we're not alone. We are connecting with other network in several countries as well. So we also had the department to taking care the policy maker engagement and public engagement to disseminate our findings and hopefully integrate that into policy production. So I would like to go through some of the major themes of what we're doing in OPRU. First of all, is about the clinical laboratory surveillance and treatment of drug-resistant infection. Now, we also have the molecular epidemiology of drug-resistant bacterial infection in Vietnam and Asia, which is part of this. I will describe some of it later, but part of it is a network that Rookies and you see part of and link into it, and that involves Laos, Cambodia as well, and that's include the study called ABACUS. But also at OPRU, we have our network with the unit in Indonesia and Nepal, and that two units is also part of our AMR network study. Hanoi leading the Hanoi unit, actually the leader in the study to study the impact of antimicrobial stewardship program in the hospital, which is led by Dr. Hương and Rukia. This study involves several hospitals in Hanoi region and also in the south of Vietnam, including Ho Chi Minh City and Dong Tháp province, into the network. And we work together with the hospital to build a stewardship program, including the laboratory improvement and working with clinicians. So I will focus more on what we are doing on One Health approach to tackle the AMR and animal human health, which is the part of that I am leading in my group. So I leave the figure here that I'm sure all of us may know about this already, just to emphasize that Vietnam is one of the countries listed at the country in the top 6 that have potential increase the use of antimicrobial in agriculture in 2030 if we don't change what we're doing right now. So how we started to do our research on antimicrobial resistance. We actually started our research as working with human pathogen and realized that lots of human pathogen resistant with antimicrobials, which have not been used for treat in human. Especially, for example, we worked with Streptococcus suis, and we found that Streptococcus suis are resistant with tetracycline, for example, which we never used in human for treatment. And then that suggested to us that the use of antimicrobials in agriculture could be the driver for that resistance. And the pathogen is also multi-drug resistant as well. So we started our study on one project we call Vibrate. It's in the center of our slide. That study is we're looking at the antimicrobial resistance between human and animal in the field, in the farms level. And this study involving farmers and their chickens, and also the control group, including rural non-farmer who live in the same region with the farmer, but they are not farmer. And also we are collecting a sample from human who live in the urban, who not exposed to farm, for example. And then in this study, we're collecting the information of antimicrobial uses in chicken farm and also for human as well. And we found that if you look at here, that the use of colistin, polymyxin here is mostly on the chicken farm, but none in the human size. Meanwhile, the ESBL, the cephalosporin, third generation cephalosporin reported to use in human, farmer, non-farmer and urban individuals, but not reported in the farm, for example. So one of the major findings we found that the use of antimicrobials on the farm is about 6 times higher than the use of antimicrobials for animal in European country, which is quite alarming finding for us. And in the study with I show the reported for colistin and third generation cephalosporin, we trusted that the antimicrobial uses is the main driver for antimicrobial resistance in our study. And also we are looking at the whole genome sequence of the strain that we collected from the study, such as the whole genome sequence of the strain containing the colistin resistant genes, and also the strain resistant with extended beta-lactamase, so extended spectrum beta-lactamase. And then we found that there is a pairs of strain with zero SNP in the core genome, which suggesting to us that there might be an exchange of strain in the farm level. We're also looking at the prevalence of colonization of strain carrying the resistant genes, such as MCR1 resistant to colistin, and we found that majorly is present in the chickens, and the lower level also detected in the rural and urban individuals, which suggested to us that even though human doesn't use colistin in the communities due to the toxicity of the drugs, but the use in animals seem to spread the resistance to the community. And meanwhile, we see as at ESB cephalosporin, third generation cephalosporin, also only used in the community for human, and it reflecting that the level of resistance with carrying ESBL in E. coli is quite high in human population comparing to the chicken population. And so that suggesting to us that zoonotic transmission of antimicrobial resistant strain was identified in our study. Again, is here we found that actually the overall use of antimicrobials for the animal farming is quite high, but not only in as a growth factor, but it's also as a treatment drug as well. We are looking at the colistin resistant transmission, and we study the risk factor for transmission of colistin resistant strains, and we found that chicken at a young age are the risk factors, suggesting that at this age, the chicken was treated or used with antibiotics a lot compared to older age. It's also that we found in human that if farmer exposed to chicken carrying E. coli, carrying MCR1 genes, would be the risk factor for farmers. And then we would like to look at the carriage duration of colistin-resistant bacteria in the farming community. What we did is that we collecting a sample from two systems of farming chickens. One we call conventional farms and the other called cooperative farm. In the cooperative farm, the use of antimicrobials are much more managed and controlled with a restricted use, and also that coupling with the withdrawal period at the end of production cycle. So what we did is that we collect the fecal sample of chicken and also the farmers and their family member. And so, and we identified colistin-resistant coliform using the plate, and we found that it's here. We say the light blue colors are the one positive with colistin-resistant bacteria, and we found that by time, if we are looking at here is the chicken sample, we only collected 2 during the production cycle, and we found they are positive at both, and each row is presented for one farms. For human sample is in green here. We collected 4 samples during the production cycle, before, like beginning production cycle, middle, at the end of production cycle, and then some human we are able to collect a sample to the next production cycle, and we found that colistin-resistant bacteria actually present in their fecal sample as well. Some of the samples from non-farmer who are the family members of the farmers also positive with those bacteria. For us, is suggesting that potential a long-term carriage of colistin-resistant bacteria in the farmer who exposed with chicken in this study. So we have a study to look at the factor influence antimicrobial usage on farms. And this is mainly done by social science approach, the qualitative approach. We found that majority of farmers have limited knowledge on antimicrobial usage and resistance, but they are the decision maker for antimicrobial usage. And that is something we suggest to the community that we need to intervene to improve their knowledge and also help them to make the right decision on antimicrobial usage. And we also found that antimicrobials present in the animal feed quite common. It's up to like 50% of the sample we collected, including colistin as well. And also farmers still assess the antimicrobial over the counter to supplement the antibiotic into the commercial feed as well. In our unit, we also run a study. We name it VPAC, led by Juan Carigmas, that we provide the farmer with veterinary support and laboratory diagnosis to study if that can reduce the antimicrobial usage on the farm. And the study found that about 30% of daily doses were reduced with having of that support. And so that means that the holistic intervention approach should be implemented. Maybe one of them may not be effective, and that needs to be considered in the community if we consider about intervention to reduce antimicrobial use in the farm. We also have our similar study to do in Myanmar as well, but here I may skip that because I would like to focus on Vietnam. So it just quickly, so that was about the One Health study for AMR that I'm leading, and here I would like to just go through, quickly going through, introduce with you about some of the other study led majorly by the group in Hanoi by Rukia Van Don, Professor Rukia Van Don, who in the meeting. So first of all, that the study about intervention to reduce the use of antimicrobials via reduce the prescription in Vietnam using the CRB trial. So this is just slide to remind that CRP is quite a helpful approach for us to use, because it's not cheap. It's point of care testing. It's quite rapid, and the finding actually show that it's quite effective. And I think sorry, I didn't show it here, but that the publication is coming out and showed it is very effective to use in the community. And the other study is that led by Dr. Sonia Lowicker, and she implemented the research, including social and participatory research in the field, but using something we call an integrated whole system intervention, which we expect is actually larger than just a One Health as well. So in the population research, Sonia ran a study on a household survey, it including the use of antimicrobials in the household level, and identify the incidence of respiratory infection. Importantly is that the findings show that the bacteria in the gut and respiratory tract actually resistant to antimicrobial almost 100%. The study is mainly implemented in Hanam province, where we have a cohort for many years. Other studies led by Rokia from our unit as well is that looking at the use of antimicrobial usage in the communities, working with the antimicrobial suppliers as well. And one of the things we learned is that a lot of suppliers in the community, they are unlicensed, but the community come to purchase or acquire the antibiotic there as they have. Something we also can, I think the next step of this study is to intervene the use from the user level. And so there is another study we call a whole system intervention collective action against AMR co-acts. This study is actually implemented in the north of Vietnam, and by the group in Hanoi. And here is the design of study that it includes quite a large population in 3 districts, and we ran for 2 years. That include the provincial and also the hospital, district hospital as well, including 64 communes. These 64 communes will be split into 4 arms with different intervention. For example, with a control group with no intervention, and then and one group with healthcare worker training only. Then the third group is that we have add-on community target messages, like we work with the community more beside training the healthcare worker. And then the final group is that there will be a participatory learning action of the study team to be there to see whether it's add-on the effectiveness of the study to reduce the use of antibiotic. And we hope that next year we can share with you more about the finding of this study. And that's it for what I would like to share about the overall the program of AMR research group in Akru, including the One Health approach that we are employed. In here, I'm sorry that I could not show with you more about what we're working on antimicrobial resistance using the whole genome sequence, but with 15 minutes, I think that's the best I can cover. Thanks so much.
Thank you, Dr. Hua. That was very informative. And yes, time is restricted, but we will be having more meetings and more of this discussions coming in future meetings. I think this is a time for a break, but before we go for a break, I would like to thank all the speakers for their informative presentations. And we will have a 5 minutes break. And after that, we'll assemble back here. and Justin will lead us to our separate rooms for further discussion on the status of AMR in the region and thereon. We've organized some videos from our beautiful region. So when your tea is warm, enjoy those videos and see you in about 6 minutes. So thank you very much.
Top. You can hike the trails through the peaceful forest with waterfall backdrops. But it's the smiles, it's the people, the uniqueness, that's the real highlight. Come experience firsthand tropical weather, see the unspoiled land, the beauty of nature. ยินดีต้อนรับสู่ดินแดนแห่งอัญมณีแห่งแม่น้ำทองยินดีต้อนรับสู่ประเทศลาวคนลาวมีน้ำใจฮักความปองดองยินดีต้อนรับสู่ดินแดนที่ยังคงเอาไว้ประเพณีที่ของแผ่นดินลาวสวยงามแท้ๆเชิญมาเที่ยวเมืองลาว Laos simply beautiful ที่ยังคงเอาไว้ประเพณีของแผ่นดินลาวสวยงามแท้ๆเชิญมาเที่ยวเมืองลาว Laos simply beautiful simply beautiful simply beautiful
Welcome back, everybody. And thank you, Harish, for putting together those videos to keep everybody company during the break. I hope that everybody's got a drink. We're all inspired for some discussions. The next stage of the meeting is going to be for us to split up into our country breakout rooms. So we've got 3 rooms there, Vietnam, Cambodia, and Laos. Please choose whichever room is most appropriate for you based on the area that you're doing the majority of your research or your interests lie. You are self-assigning to rooms. There are a couple of points that we'll discuss during the breakout rooms, and myself, Harish, and Leanne will be in the rooms to help guide and document those discussions. We'll be talking about some of the big questions or opportunities in research in your country and the research needs for your country. That's the first part of the discussion. The second part of the discussion is to look at what are the challenges to implementing that kind of research, answering those sort of questions in your country context. And then the third and final part of the discussion is to think a bit more regionally. What would be the big questions and the big challenges to doing that research on a multi-country regional basis? The way that we've organized it is that we'll have these discussions using a whiteboard. So as you share your ideas or your suggestions, we can list those out using sticky notes, which we're then going to move around to try and get a ranking. That sounds kind of confusing, but I think it'll be much more obvious what it is we're trying to do once we get into the breakout rooms and actually begin the discussions. The talks have been a fantastic start to this meeting, and already lots of our presenters provided lists of challenges and their suggested rankings. So I think we've got a really good basis on which to start our discussions. Final note before we go into our rooms is that there are a lot of us in these rooms, and really encourage you to raise your hands, unmute yourselves, and have your voice heard. We're really interested in all the different kinds of perspectives that people can bring to that. That is the purpose and the sort of joy of One Health style of research. So please encourage you all to participate as fully as possible. We will have approximately 30 minutes in these rooms, so you can split your discussion into 10-minute blocks. We'll let you know when the discussions are almost over. The first thing to do when you get into your room is to identify who will be the reporter for the group. So although Leanne, Harish, and I will be there to take notes, we'll be inviting somebody from the country group to present those, summarize those discussions in a feedback session, just 5 minutes after the breakout rooms are over. Okay, hopefully that's enough of an introduction and we all know what we're doing. We're going to be there to help guide the discussion, so please don't worry about that. So I will stop now and then I'll open the breakout rooms, and please go ahead and join your room. I will look forward to seeing you in about half an hour. Hi everybody, welcome back. Half an hour goes past extremely quickly. I'm hoping that you all had really useful and fruitful discussions and that the technology worked somewhat. So now we're going to have a debrief from each of the teams. So we'll go one country at a time. Leanne, Harish, and myself will share the whiteboards during the discussions as we go along. So we are currently seeing Leanne's whiteboard, which is for the Cambodia team. So I'm going to suggest that we go first with Cambodia. So who is going to do the feedback from Cambodia? And remember, 5 minutes, guys. Thank you so much.
Sorry, my screen is kind of messed. I thought I could do that offline when no one else was looking. So sorry about that. Dr. Satiratum has kindly offered to speak to our discussion that we had. I hope you can make some sense of that screen, but also we had Professor Daniel Tan took some notes in the chat that you can also refer to. Dr. Tum. Satira, are you able to speak to our discussion?
Sorry, Yeah, I cannot unmute it. Now it's okay. Okay, thank you. Yeah, there's our group has able to identify some potential research question that need. Yeah, I cannot see from the screen. Only see the dot. I don't know why.
It may be that you need to zoom either in or out, Dr. Satira.
Zoom.
So there should be a option to zoom in and out, a little magnifying glass with a plus minus in the bottom right of your screen.
Okay, but how to move around?
Perhaps, are you able to see Daniel's chat? He put most of the notes in the chat, if that might be easier to read from.
Okay, I think go for the chart. It's maybe easier.
Yeah.
Okay, thank Daniel for capture all this. Yes, I think it's clearly mentioned there's some study has been conducted, including CARBs, the study to identify the bacteria, potential bacteria that has been isolated from both human and animals. So what's the result from the discussion? I think Dr. Paul Turner has raised a good question, saying that the country still have limited information on the AMR, and particularly the burden of AMR in both human and animal. So this should be considered as the one of the potential study, and particularly the link between the interrelation between the infection in human and the animal should be looking at them as well. And yeah, along with this, a lot of people has been raised about the issue related to the research need, particularly the fund for research, because this based on the donor, and it's always ad hoc, and the research topic is on the interest of the donor. So this has been noted, and the good. It's better to get some budget for the technical working group in Cambodia to conduct this work. Yeah, like I said, Dr. Chopuna asked a thing about the measure of the burden, particularly outside the hospital. At NAPI, we don't have capacity for sequencing all the isolate that we have. So we are now working with the National University of Singapore to ship all the isolate to for the sequencing in Singapore. This is the agreement between the two institutions in our study. There's a limit knowledge with the within the fishery sector, particularly at the all the there's no lab has been proper lab setting up for really for this study yet, yeah, I think our colleague from fishery administrative mentioned about the finding of some residue in both residue from pesticide and antibiotics in fishery fish and fishery product. The our group also discussed about the organization that involved in this study, And one colleague from Human Health mentioned about the conflict of interest between the people who sell the drugs and the people who use it in the field. So this also need to investigate, deeper investigate, need to raise also awareness for the health professional and the community on the importance of antimicrobial resistance. And then there's some proposal of setting up a proper surveillance for an AMU. People also mentioned about the development of the antimicrobial stewardship in the country and the communication material as well. Introduced into the university curriculum has been raised, and this has been this program has been early included in the veterinary science curriculum already, including in the pharmacology section. So this all from our group. Thank you.
Thank you so much, Dr. Satira. Appreciate that.
Any further input from the group? Thank you.
We will certainly summarize the findings from your discussion, and we'll circulate those after this meeting. So really appreciate that input. Maybe the next group to share could be Vietnam. So I will share our whiteboard, and Dr. Ngo Thi Hoa will report back on our discussions. So thank you very much, Hoa. And I will give you a warning when you're approaching 5 minutes. Thanks.
Okay, I've just tried to signal that I was muted and I unable to mute. So our group discussed about, first of all, we start our discussion about what is the big question and opportunity for Vietnam. So our research that I shared with you earlier, that we again mentioned about the bidirectional transmission of antimicrobial resistant bacteria between human and animal in the One Health. We also mentioned about how can we learn more about, and sorry for that we said the antimicrobial usage in both sides of the One Health are the driver, and whether at the moment how can we study to have that, how can we capture the direct evidence to show that which direction that the certain antimicrobial bacteria or microorganism are transmitted from, and that and we also talk about the opportunity for us to working on work with aquaculture as well. I work mostly not just off-road but other also work on farms a lot, but aquaculture quite an area for to explore. We also talk about opportunity to repurpose the old drugs, very old narrow spectrum drug, for example, to use in both end, because animal and human, they are both needed a drug, effective drug for treatment, right? And the opportunity to work with policymakers as well. If we have a direct evidence to show and share with policymakers, would be great to convince them for the appropriate policy. We also mentioned that in Vietnam, Vohun also a platform for us to connect with researchers in university and also to inform and train the next generation. That's also opportunity to tackle the antimicrobial resistance. We realize that Vietnam is an agriculture country, and so the antibiotic, if we don't have any alternative for antibiotics, then it will be used for a long time. So research on the effectiveness of alternative product to antibiotic would be an opportunity. For the challenge to conduct a study in Vietnam, I mean, the big thing people put it on is the funding. We do have great scientists, we do have a great field to study, but the funding is an issue. And I mean, all of us know that funding for AMR is not that small when we need both animal and human in our study as well. And now we're also talking about one side of our study are farmers who are having economic driver for their business. So it seems to be that a conflict of interest when they join with us and in our study we needed them, but joining with us whether it's harm their business as well. So something is quite a concern. That's also the challenge. The other
1 minute more, please. Wow, sorry.
The other challenge is that if we do the intervention, the availability of antibiotic in Vietnam is everywhere. You can get it from anywhere, and that's something we should aware of. And also the big network for research, it needs to be in place. We also mentioned about the regional challenge as well. Is the trust. The big thing is about the trust with the people there and local people, local farmer. Also the sensitivity, political sensitivity as well as our experience in Myanmar. But we also feel like we have to build for a long time to get the on-site research team for a local language, local custom and behavior as well. So that's what something we are talking about. But we are aware that network connecting with other network in Cambodia, Laos in the region would be a great opportunity. Yeah, thanks.
That's wonderful. Thank you so much, Hoa. Hand over to Harish to share the discussion board, and we'll hear from Lao.
Yeah, thank you, Justin. In our group, I think Dr. Vanafon is going to summarize the findings. So over to you, Dr. Vanafon. Again, 5 minutes. I'll let you know when it is 4.
Okay, thank you, Harris. Thank you, Justin. Okay, this is the result from our brainstorming from Lao team. So we have 3 topic together. Okay, maybe I start with the first research need. So we understand now we need to do a research together between a leader from 3 sectors like a human, environment, and animal sector to do is need. And the data from One Health, because we understand AMR is kind of One Health issue as well. So we need to do together about this. And the second one, okay, when we're talking about weight, we focus on animal. So we understand, okay, like the AMR happen from the animal is happen in any aspect, maybe from feed, from treatment, or other as well. But for treatment, okay, in Laos, I think it's very rare. But from animal feed or animal additive, I think is a big burden and a big issue. So we need to do more about this. And also, when they put some antibiotic in the water for their animal, like a poultry production, something like that, this kind of problem as well, because of the farmer awareness is really there. So we need to use this one as well. And the third one, we're talking about the antibiotic value chain or antibiotic use value chain. It is very important. So we would like to know where is antibiotic was used exactly. Number 4, okay, we did a research basic on the animal, but how about aquaculture as well? I think it's very important because it's related to what do we call environment, because it concerns to the water quality, water contamination, something like that. And also from one guy that he worked with the Department of Livestock and Fishery, talking about the regulation and policy. I think it's very important as well. Okay, we have a paper regulation, but it's talking about the practice. It's difficult to do this one. Yeah, so we need like a KAP as well, gap analysis across the sectors, human, environment, and animal sectors. Yeah, assess the knowledge of the stakeholder, like a farmer and commercial enterprise, something like that, is very important, because now in Laos, okay, we have like a drugstore, veterinary drugstore, we have like a animal feed plus drugstore as well. So the farmer, when they came to those drugstore, they didn't have any knowledge about antibiotic use or antibiotic resistance. So they asked from the staff, they asked from the labor there. So maybe it's wrong recommendation or wrong prescription. I think is very important. So we should do this kind of assessment. So control of antibiotic sell drug in the drugstore, in the pharmacy is, I think, is quite the same with number 6. So number 8, regulation for number of drugstore, not criteria. This kind of number 6, number 7, number 8 is quite the same. I think at least you can add. Okay, number 9, research on antibiotic in human and in animal farm in remote area is really neat. So because the farmer, they don't understand well about the AMU and AMR exactly. And number 10, that we need to do the research, okay, because of the data or information from animal sector is quite small. Maybe they did the research, but the report or the what do we call, journal or publication is not so many. So maybe we can push this kind of work more about. This is a quick brainstorm for our team for like a research need. Maybe another one can add. For the challenge for the research, sure, we understand lack of awareness among the farmer or general community. Yes, it's really low. Also,
so Dr. Wanafon,
the staff as well.
1 minute left.
Okay.
1 minute left. Yeah.
Yeah. Also, the staff as well, especially for the veterinary or medical professional as well. Lack of network between our different sector, especially for three leader like a human, animal, and environment. Sure, number 4 is the big challenge, funding from maybe from the government, from the NGO, from other country. Yes, we need. Number 5 or number 6 is quite related together. Okay, human result. We lack of like a human result to do like a diagnosis, like an expertise to do like a this kind of work. Yes, timeline for report. Yes, is need for the general. For the regional for the regional challenge. I think we lack of the network and okay, transboundary disease. I think is one. Okay, we should contact with other network as well, like Vietnam said, Sihun, and also for 3 country and okay, Australia. So we should have like a different lab, something like that. We should help each other because we are in the same region. Yes, thank you from Laos. Okay.
Yeah, thank you, Dr. Wanafon. Back to you, Justin.
Hey, thank you. Sorry, we're just finalizing a poll. So we're having looked at some of those regional challenges that you identified. We're going to shortly present those as a multiple choice question and ask you to rank what you think are the top 3 challenges amongst all of them. So we've picked out several things. I'll just list them now and then present as a poll. So we have the lack of laboratory infrastructure. We've got barriers to data sharing. We've identified inadequate or sometimes inflexible funding. Technical limitations. So maybe there's an absence of whole genome sequencing capacity. The problem of coordination between ministries or departments within countries and regionally. A problem with trust, and that can be trust between the researchers and the farmers or stakeholders. The problem of cross-cultural understanding, so really understanding the context in another country and being able to design a project that would be appropriate in more than one setting. And finally, economic and political sensitivities. So that poll should be available for you now to just pick just 3. So you'll be allowed to pick as many as you want, but please restrict your choices to 3 of those. We'll take a moment to let you complete your answers, and then we will share the results of that poll. Thanks, everyone. So we have 23 responses so far. We'll just give that another 1 or 2 minutes to make sure we've got as many people's answers as possible. Thanks. Okay, so we're going to end that poll now, and you can see the results on your screen as to what were highlighted there as the main barriers to doing the regional sort of research that we're interested in doing. So at the top of the results is inadequate and inflexible funding, followed closely by the lack of physical infrastructure and technical limitations. This has been extremely useful and interesting to hear from everybody, to hear both the presentations and the discussions and the feedback from those breakout rooms. I'm really grateful to everybody for joining and making such great contributions. Our plan for the next couple of stages of this project, the most immediate one is to summarize those discussions that have been had and held on the whiteboards, and we will distribute that back to the participants in this group. So a kind of mini report and reflection on the discussions that you so generously contributed to. So that will be forthcoming in the immediate future. Of course, we'll also share the results of the poll. The next stage for our project per se is that we'll organize another meeting in the coming months, and that will be an opportunity now for people who have joined this meeting or others that might be interested in going forwards with forming a research network. The long-term goal, or the end point, I guess, it's not so long-term, it's about 6 months that we have to advance this, is that we would have a network of One Health AMR research-focused laboratories who are willing to work together on future projects that should they become funded. So we've highlighted that one of the main concerns is a lack or inflexible funding, but we need to be ready to go for that funding when it does become available. So when big regional funders provide money, do we have the network in place that can say, yes, we can spend that money effectively and we can answer questions? So the next steps will be meetings to really work out what capacity we have, what interest we have to work together and share a unit, share a network, and ultimately to investigate those barriers in a more kind of small group, deep way. What are the barriers? How can we fix the barriers to data sharing and governance? So that is what is coming up in this next 6 months. I will hand over to Harish now as we close the meeting and thank our presenters. Thank you, Harish.
Yeah, thank you, Justin. Yeah, it has been a very fruitful meeting. I would like to thank all our speakers who made time and their resources to put forward such an informative presentation. I would also like to thank all the people who have joined this meeting. I would also like to thank the people who could not join the meeting because of some compulsion, some work, they were busy somewhere else, but have completed the registrations and have answered the Qualtrics questionnaire. I would like to take this opportunity and appeal to you to again pass on those Qualtrics questionnaire. It's still open, and if you know anyone of your acquaintances who are working in this field in your country, kindly pass that on, and that data will be very useful for us. Finally, I would like to thank Leanne and Christine, who are working behind all this thing to make this successful. And I see that we are closing 5 minutes early than the schedule, and that is a very good sign. So thank you all for this lovely time, such informative time. And last but not the least, I would like to, I'm hoping that we will have a larger number attending this in the next session. So thank you so much and see you next time. Until then, see you. Bye-bye.